The nose is the centerpiece of the face. It is no wonder that a slight deformity of the nose causes significant insecurity in people. Luckily, in today's world, the technology to fix this exists. Hello, I am Dr. Priya Bansal, a board-certified cosmetic plastic surgeon practicing in the leading hospitals in India. I hope you all are doing well and keeping yourselves safe from the latest outbreak of the new COVID variant. Today, I am here to talk about rhinoplasty, commonly known as nose job, and how it holds the ability to not only change your appearance but also to relieve of some of the functional problems. Yes, when rhinoplasty is combined with septoplasty, it is called septorhinoplasty. This combination technique can fix any dissatisfaction you have with your nose. Whether you have a nasal deformity, a deviated nasal septum, or you are not happy with the shape and size of your nose, anything can be corrected to make your life easier and happier. So before I go deeper into the surgical procedure, first let us see the structure of your nose. Now the nose is made up of the bones and the cartilage. The upper part of the nose is mainly bony, the hard part which you can feel, and the lower part of the nose is mainly cartilage. Now again, the cartilages, they are of three kinds. The central cartilage, which is also called the septum, the septal cartilage, the upper lateral cartilage and the lower lateral cartilages. Now covering all of this bone and cartilage is your skin on the outside and mucosa on the inside. The septal cartilage is what separates your nose into two halves with the nostrils forming the entry. And this septal cartilage is the part which is most prone to deviation, which gives a deviated look. It can get deformed into an S or a C shape or just a little deviation. So when this happens, the entire nose looks deviated and it is not the centerpiece of your face anymore. And correcting this deviation is what is called a septoplasty. So what is septoplasty? In septoplasty, a portion of the septum is removed. It can be the central part, it can be the lower part, to make the remaining septum straight. And along with this, if the patient wants to improve the overall shape of their nose in terms of shape, weight, aesthetics, the base of the alar cartilage, or to correct any hump, rhinoplasty is combined. So how do we do rhinoplasty? For a complete open septorhinoplasty, an incision is taken here at the base of your nose and two incisions are taken inside the nostrils. Through this, the entire dorsum is elevated like the cover of a book, and then depending upon the corrections required, the changes are done. So first of all, let us understand what is osteotomy. Osteotomy is when the bony part of the nose is broken to give it a better, sharper look. So a small incision is made out either on the outside or from the inside depending upon your surgeon's preference, and the bone is broken, and then the bone is brought inside to give a narrower shape to the bony base. Now if a patient has a hump, that's an elevation on the dorsum, that also is corrected. Either if it is a cartilaginous hump, just the cartilage is cut off. If it's a bony hump, the bone is reduced. Now the bone can be reduced either with the help of a chisel and osteotomy, or it can be rasped, or it can be done with the help of a piezotome. So we have a piezotome, which is an ultrasonic device very specific for bone to remove that bony hump, the extra piece of bone which projects on the upper part of the dorsum. The advantage of using the piezotome is that since it is very specific to the bone, the trauma to the surrounding tissues is less and so the overall recovery is better and faster. Now let us understand what is dorsal grafting. Dorsal grafting is required for patients who have a reduced nasal height and they want an increase in the height to give a sharper nose. So what is done? One, the osteotomy is done, the bones are broken so that they become narrower and the height increases. Second thing what is done is dorsal grafting, where a cartilage is placed on the dorsum to increase the overall height of the nose. Now this cartilage, if a minimal height increase is required, it can be taken from the septum itself. If too much of height increase is required, it may be required to take the cartilage from the ribs. Now, a third step which may be required in some patients is the reduction of the alar base. So, some patients may have very wide nostrils and they may require a narrower nostril. So, in these patients, the alar base is resected and it is sutured back to give them a narrower nostril, narrower nose. Now, some patients may have a droopy tip pointing down and they may want an elevation of the tip. So, in these patients, multiple steps are done to improve the overall appearance of the tip. These steps may be suturing between the alar cartilages, resection of a part of the septum, putting in a tip graft, and many other things. So, all of this is done to improve the overall appearance of the tip, making them thinner, pointed, and projecting up. So after the surgery, a splint is put on the nose, and this is like a plaster which ensures that whatever new structure has been given, it stays in place during the healing process. This splint, it is removed after a week of surgery, and then you can see the changes which has been taken place, which has been given to your nose. You would be able to see that the hump is gone. You'll be able to see that the base has become narrower, the nostrils have become narrower. But of course, there is some swelling in the tip, which takes few weeks to go down. In the initial part, almost 60 to 70% is gone by 6 to 8 weeks. But the tip swelling, it keeps on improving between 8 to 12 months. Now, let me address the most important question. Is breathing possible immediately after the surgery? So, immediately after the surgery, there will be packs inside your nostrils, because of which you may have to breathe through your mouth. You may not be able to breathe through your nose. These packs may be removed 24 to 48 hours after the surgery, depending upon the extent of changes which have been made. You might obviously feel a little breathing difficulty during this phase. But after these packs are removed, you are able to breathe normal. There can, of course, be a little nasal congestion, which gets relieved over a period of time. So, breathing is not affected negatively after a rhinoplasty. In fact, it improves over a period of time. Whatever blockage you had because of the deviated septum, that gets improved and this functional problem is gone. So, this is all from my side about rhinoplasty and how it changes your life. If you have any further questions, do post them in the comment section. I would be happy to address all of them. For more informative videos on plastic and cosmetic surgeries, do not forget to subscribe to our YouTube channel and press the bell icon. I will see you soon with another interesting topic. Stay beautiful, stay cool. Bye-bye.